Okay, here are my 5 audience members. Hello. Okay.
Speech.
Yeah. Okay. If you're expecting a baby, you're probably taking all of the precautions to make sure that you and your spouse remain healthy and happy, right? Well, it's also important to remember that certain health problems, conditions, birth defects, and malformations cannot be prevented, such as spinal bifida, Down syndrome, or in this case, Epispadias. Meet Drew. When he was born, he was supposed to be a girl. Obviously, he came out and he was a boy. He was diagnosed with Epispadias, and Epispadias is a congenital condition, meaning that it's only present at birth. They didn't see it in the sonogram or anything like that. It affects the penis and the vagina. Crap, I missed. Hang on. It affects the penis and the vagina, and it makes them look abnormal. Epispadias affects 1 in 117,000 males and 1 in 565,000 females. Some of the birth defects include the bladder, the large intestines, the urethra, and in more severe cases, bladder exstrophy, which is where the bladder is on the outside of the body. Many of these complications are associated with, there's life struggles as several surgeries, the cognitive health, kidneys and bladder issues. Some of the kidney issues are kidney reflux. It's a condition where the bladder, where the kidneys, the urine will back up into the bladder. And that can also affect the fertility. It can be deferred by antibiotics. Drew was on antibiotics for the first year of his life. He had to take Bactrim every day. In males, the defects are short and curved penis. The tip of the penis will be split, forming a gutter. That is corrected during the first year of life. They'll go in and they'll have a reconstructive surgery. They'll reroute his urethra and change the cosmetic look of it. That's all that surgery does. Children will remain incontinent, meaning they cannot potty train. There is a surgery for that will, it's for the bladder neck, and it will close the bladder neck. That is not always successful. When that is not successful, they will go in and do a bladder augmentation, which will, they'll use a piece of the small intestines and connect it to the bladder and use the small intestines and reroute through the bladder. So they'll use all of that to make his bladder bigger, and they will take and do a catheter, so he would never TT out of his penis. He would just TT out of his little catheter spot, and he would catheter himself every 4 to 6 hours. Female organs are normal and generally have no issues with infertility. When they're born, they're really not diagnosed at birth because it's not as noticeable. Their hips are just laid out a little bit more, which would cause their clitoris to be split. Their organs are fine generally. They can reproduce with no problems, as to where when a male ejaculates, their sperm will move back into the bladder. Epispadias cannot be prevented. However, it is manageable. Babies that are born with Epispadias face several complexes in their lifetime. However, with proper treatment and diligent care, they can overcome these difficulties to lead functional and well-adjusted lives. And that's all I have. I was really nervous fail.